Hi, my name is Bridget Barnhart. I am a family medicine physician assistant, working mostly with adults now. I was previously working here in family med and then transitioned over to dermatology for 2 years, and I'm back. And I really missed being in family med, and I'm looking forward so much to rebuilding those relationships, working with you here at Memorial Regional Health in Craig. I have been at Memorial Regional Health for about 3.5 years. It'll be 4 years in July. I came in initially in family medicine. I'd previously been in an internal medicine role in my practice down in New Mexico. I was here for about 1.5 years with working alongside Dr. Kipe, and I had the opportunity to transition to dermatology, to be in Steamboat Springs, and really learn a lot under Dr. Good. I found dermatology to be really interesting, and I learned so much working alongside her and completing a fellowship in dermatology through the Society of Dermatology PAs. But I kept diving into general practice. I couldn't stop wanting to treat everything. And I really missed that role and that connection with people that you have when you are looking at all of their problems in the puzzle of not just one system, but how does everything fit together. And so about 4 months ago, I made a hard decision to leave dermatology and return back to family med, but with a focus on adult medicine again, kind of my roots. I was drawn back towards my role in family medicine after being in dermatology for 2 years, kind of realizing that I love that continuity of care and working with people over a whole host of issues and figuring out what are the underlying components to their health concerns. So my medical specialties and interests have evolved over time. Initially, cardiology was one of my areas of interest that I really love. Cardiology is fun because things are fixable. But then after being in dermatology, now when I'm talking to my colleagues about patients, I just have this ease and comfort with skin now that I'm very grateful to have. And now I feel very comfortable kind of knowing who needs to be referred on to dermatology, because there's a lot of people I might not have referred before that now I would. And also what I can manage and kind of build on the knowledge that I did gain in that, but within the context of it being internal medicine. Within a family med context, the type of services that I'm going to be offering are fairly varied. We do treat a range of issues within family medicine, anything from joint injections for people with chronic osteoarthritis in their knees to working with people on cognitive assessments to check for dementia or looking at fall risk for people who are in an older patient category. Also, I'm going to be working with Dr. Miller. We're kind of reestablishing the wound care clinic, working with people on chronic wounds. So that's a new area of interest for me and something that we're going to be providing. It was provided previously within the clinic, but we're hoping to kind of ramp the service up and really provide cutting edge wound care here to the Craig and Moffat County community. Biggest part of my role is to make sure that you don't end up in the hospital if it's not necessary. So I'm really working with my patients to keep them in the best shape possible and make it so they can meet their goals and do what they want to do in life is the most important thing to me. As my patient's primary care provider, what they can expect from me is a consistent, thoughtful, present person. I'm the person that's going to be making sure that all of the results and the pieces are brought together. I'm going to be the one that makes sure that when I send you out for a referral, that referral is actually made, that the appointment is happening, that you're getting the full care that you're expecting to get. I'm also going to make sure that you get all of your results and that we don't miss any of those pieces as they're rolling in. Coming back to family medicine, I realized how much I really, really loved my previous patients. I mean, I really enjoyed working with everybody and appreciated the Craig community and missed it a lot. I missed having those relationships and already walking down the halls and seeing people and them saying like, "Oh, Bridget, you're back." And it just feels really great. It's a fun group of people, and this is what it is all about, you know, being in a rural setting and working with people in this community just is always it's always fun. I always enjoy it. It feels really great to have already been seeing some patients back again, and I'm looking forward to seeing all of you more.